Hello, everyone. Welcome. We're working on getting everyone connected and we will get started shortly. Give just about another minute here. All right. It looks like everyone is connected. Please mute your microphones to avoid any accidental disturbances during our presentation. We want to thank you all for joining South Dakota Project Firstline's January office hours. Today, we will be discussing bloodborne pathogens. This project is sponsored by the South Dakota Healthcare Associated Infections Antibiotic Resistance Program. We have a little smaller crew today. The South Dakota PFL team is employed by the South Dakota Foundation for Medical Care. We present infection prevention training and education through South Dakota Project Firstline. Project Firstline is the CDC's National Training Collaborative for Healthcare Infection Control. My name is Rebecca Syme, and I serve as the team lead. I'm a registered nurse with a varied background in healthcare. I'm certified in infection prevention in the long-term care setting. I'll give Jess a moment to introduce herself.
Hi, everyone. I am Jess Stanko. My background is healthcare and long-term care administration. I'm a registered respiratory therapist and also certified for infection prevention in the long-term care setting. Currently, I am a program director with the Foundation for Medical Care and also assist with the HAI work through the Department of Health.
Awesome. We have Mindy and Renee busy learning some good stuff today, so they aren't able to join us. A couple of reminders before we get started. Feel free to ask questions. Excuse me. Add them to the chat or come off mute. We encourage you to share stories or comments for discussion and learning. We're recording today's session and it will be added to the South Dakota Project website, South Dakota Project Firstline website, excuse me, at a later time. And please complete the post-presentation survey. We really do appreciate hearing from what you have to say. From here, Jess is going to present for us today, so I'll let her take it away.
All right. Thank you, Rebecca. So today's topic that we're going to talk about is bloodborne pathogens. For the objectives, we're going to talk about what a bloodborne pathogen might be. What are the risks? So needle sticks and infectious materials, and then prevention. So the hierarchy of controls, sorry, I can't talk evidently, exposure control plans, and then Sharps injury prevention program. When we're talking about bloodborne pathogens, we really need to pay attention to occupational exposure from needle sticks and other Sharps injuries. It's a serious problem within healthcare, but is also often preventable. The CDC, or Centers for Disease Control and Prevention, estimate that each year 385,000 needle sticks and other Sharps-related injuries are sustained by hospital-based healthcare personnel. Similar injuries occur in other healthcare settings, such as nursing homes, clinics, emergency care services, and in private homes. Sharps injuries are primarily associated with occupational transmission of hepatitis B, hepatitis C, and human immunodeficiency virus, but they have implicated in the transmission of more than 20 other pathogens too. So it's not just those three, there are potential for many other exposures. Next slide, Rebecca. Gonna let you guys get a little active. You can put your answers to this question in chat or come off a mute and share what are some of the bloodborne pathogens. Name 3 of them. It's a test of if you were truly listening to me babble and try to get through what I was trying to say because I just shared them with you.
I gave you a bit of my stumbles there too. I apologize. I'm like a frog in my throat, and I just passed that right along. Looks like Tiffany Peterson in the chat says HIV, HPV, and HCV, and Mary
Yes.
says same.
Exactly. So bloodborne pathogens are infectious microorganisms present in the blood that can cause diseases in humans. As we mentioned, they are HBV, HCV, and HIV, which is the virus that causes AIDS. Workers exposed to bloodborne pathogens are at risk for serious or life-threatening illnesses. Next slide. So we're going to talk about what bloodborne pathogens are. It is vital for our healthcare workers to be informed about ways to protect patients and, really importantly, themselves from bloodborne infectious diseases. Bloodborne pathogens of primary concern are the three that we have just mentioned, but there are others, so keep that in mind. It's not just three. Occupational exposure to bloodborne pathogens from needle sticks and other sharps injuries is a serious problem, and it is preventable. The CDC estimates, as I said, that those 385,000 injuries happen, especially in the hospital setting, but really think about that in any setting where you're providing healthcare services or offering any of that type of stuff for, oop, I lost the presentation. Rebecca, did I lose you too? Oh, you're muted.
Are you having trouble with seeing mine?
Yeah, I see all the attendees, which is a great number of you today, which is fantastic.
Oh, you know what? It just all of a sudden kicked me off of share. I see that. So let me let me try
Sorry,
that
guys,
again.
for the technical problems we're having.
Two people. Okay. Oh, hold on. All right. Let's
Explicitly and implicitly clear.
As we're getting this fixed, just going to remind you guys all to mute as you're coming in. You are not muted when you join the call today.
just, I'm not sure. I keep clicking the share here and it won't let me highlight the screen. So, and I'm not honestly sure why
We
it
can
kicked me
still
off.
see the
Let me,
bloodborne pathogens
okay, there we
slide.
go.
Oh, you guys can see them. I just can't. Okay. Well, let me just.
Sorry, it doesn't show me that I'm presenting anymore or that I'm sharing screen anymore. But Tiffany, you said you can see the presentation still.
I can. I don't know if it'll advance, but I can see a slide. What are bloodborne pathogens? Oh, there's where's the risk?
Okay,
Okay.
so
And back to bloodborne pathogens.
thank you for that.
Well, let me talk about bloodborne pathogens a little bit more here, and then we will go on to where the risk is. So as I mentioned, that exposure to these pathogens from needle sticks or the sharps injuries really are a serious concern and problem, especially for those of our staff and people coming into our facilities. Just by that simple, maybe it's a scrape on the arm that breaks the skin. Maybe it is an actual needle stick or different things like that. The one thing that Rebecca and I find when we're going into our healthcare facilities, and Sherry's on the call with us, she's gone on a lot of ICARs as our co-worker and team member, is understanding what maybe a sharps injury is. Sometimes there's not a true understanding that, you walked into the room and you scraped your arm on a countertop and it broke the skin. That can be considered a sharps injury. The other thing that we are finding that maybe would be beneficial in educating your staff is when we ask them, what's the first thing you should do when you experience a sharps injury? There's always a hesitation, of course, when we're asking questions, but 9 times out of 10, they say, report it. I'm going to report it to my infection control. I'm going to report it to our occupational health, whatever. So we have to really get in the habit of educating our staff that you need to go find soap and water and you need to wash it. And not just for a light scrubbing, you need to really scrub it with that soap and water for up to 20 minutes to really help to circumvent that exposure and take care of the wound properly. And then reminding our staff, yes, of course, we have to go report it. So just making sure that we're getting that education out to our staff when they experience a sharps injury and really what a sharps injury can consist of within your facility. So next slide.
Samantha chimed in and she said, clean the area. So that's right in line with what we want to do for sure.
Absolutely. So since I can't see Rebecca's slides, I am assuming she is at the where is the risk slide.
Yes.
Fantastic. Thank you, Tiffany, for co-hosting with us today. So when we're talking about risk, we really need to keep in mind that exposure to infectious organisms such as bacteria, viruses, parasites, that's a common thing in healthcare. We all know that. The bloodborne pathogens are really a concern because it's a daily risk. We are always dealing with needles, mucous membranes, and skin exposures. When you look at work experiences and our staff coming in and out of there, we really have to pay attention to that. Contact with blood or really any bodily fluids are a big part of this. And if we go to the next slide, we have a really comprehensive list of what these are. Sometimes it takes reminding our staff, our nurses, what might be considered some fluids. So if you go to the next slide,
We are on potentially infectious materials slide.
that's fantastic. And this is that list I'm talking about. So this can apply in the healthcare setting. And if you look on here, or if you do dental procedures in your facility, one thing that sometimes there is some confusion on is saliva. Yes, we talk about bloodborne pathogen exposure when there's blood present in any fluids, of course, but saliva is considered whether or not there is visible blood present. So keep that in mind. And then very common things, amniotic fluid, any cells, tissue, or organ cultures that are obtained, those are potential for exposure. Pleural fluids, semen and vaginal secretions. So that's really why it's important when we're looking at ultrasound probes and cleaning and that type of thing, is staff able to avoid any exposures there if they have an open wound, whether it be from a scrape, a needle stick, those type of things that might have happened. So just want to highlight and touch on those for that moment. And then Rebecca, if you want to go to the next slide, we have another
We are on to the
question for our wonderful audience.
Go
And
ahead.
I've talked about this too. How long should you wash the area after a stick or a puncture?
We
And
got some answers coming in.
Perfect.
Looks like Audrey says up to 20 minutes. Sherry says up to 20 minutes.
Absolutely. That is the recommendation. Up to 20 minutes, really thoroughly scrubbing that with the soap and water and reminding staff to really keep track of that. You know, sometimes 20 seconds even for washing your hands might feel like a long time. When we're talking 15 minutes, that is a long time of standing at a sink and scrubbing and cleaning that area. So, you know, maybe it's even encouraging staff. If you get a sharps injury and you're going, you need to set your timer to make sure you're getting to that time, you're properly washing, those type of things. Make sure if it's a big laceration cut, those type of things, they also apply that direct pressure to stop the bleeding. Flush mucous membranes with water if there's a potential exposure there. Mouth, rinsing that several times a lot with water. So if they happen to be exposed in that area, the eyes also have to be considered. If your healthcare provider or your nurse, your staff member happens to get it in their eyes, if they have contact lenses, make sure that they know they need to remove those and then get to the eye wash stations. So if there's an exposure there, they should flush their eyes for a minimum of 15 minutes. If your eye wash stations are not available, they could use appear to help flush those exposed eyes to really make sure that they're getting those flushed out thoroughly. And like I said, 15 minutes again, so that's a long time. Next slide.
And I'll chime in. We gave this, not this presentation, but we're talking about this similar topic with a group of professionals that do home visits, and came about is how long do you wash and how long do you flush, and then followed that up with, then follow your policy and procedure. And at that moment, they were like, "Ooh, I don't know if we have a policy and procedure." So, just another thing is like to think that all the way through. We can say, then make sure to follow. Do you report? Do you report to the ED? Like, what are your processes? But for what? Make sure you have a policy in place. Another thing to think about is management of those eye wash stations. Are we following the rules and the guidelines for flushing them and replacing them and doing checks and things like that? So, all right, what if exposure occurs?
Absolutely. And this really kind of highlights what I've just talked about already. So washing that needle stick or cut area, flushing nose, mouth, or that open area where the skin's no longer intact. Making sure that eyes, if there's an exposure there, they understand that something splashed in our eyes, that is truly considered an exposure. And what's our process for that? As Rebecca mentioned, what's our policy for reporting that, and to who does it go? Does it go to a supervisor? Does it go to infection control? Does it go to occupational health? And then we did include in the PowerPoint today, there is a phone number that you can utilize and call in if you have questions or need additional information for work exposure. So that will be available on our website once this presentation is published. Next slide.
Prevention.
Perfect. So we always have a hierarchy of controls. So there's that elimination, the substitution, on down. So I just want to touch on those briefly and just talk through those a little bit. Elimination, of course, removes the hazards at the source. So this could look at things like changing our work process or stop using certain objects. And sometimes maybe it takes an incident such as a sharps injury for it to really come forward that maybe this syringe we're using isn't to the best safety practices or those type of things. So really looking at what can we do to eliminate any potential hazards, and then substitute, as I mentioned, or that substitution. So is there a safer alternative? Are we seeing that the sharps injury happened because of something that we could replace? When you're considering a substitute, make sure you compare any potential for new risk that's a substitute might pose to. And always consult your staff that are frequently using these items. I know sometimes not the easiest, and it is time consuming to go back to staff and say, hey, what really do you think of this new, or let's try this out and get some feedback on it afterwards. Those are opportunities to really offset potential injuries and to get true feedback for the people that are out there on the floors using those items. There, of course, are engineering controls, of course, as we know. One of the things I want to talk about are sharps disposal containers. There are some parameters or things that are best practices that we need to pay attention to. Things like, is the sharps container puncture resistant? Is it plastic or metal? Is it designed with lids that allow for those sharps to be easily put in there? Is it too small for the hand to enter? If the hand can get in there, there's a high potential for a needle stick. So making sure that we don't have huge sharps containers that we're utilizing on a routine basis where your staff might accidentally stick their hand in too far and get exposed. Making sure we have those located in ideal places and that they're not overfilled is a huge thing. When we're talking about this, just some things I want to mention as I said, we're in those facilities a lot. Your sharps containers need to be secured. They can't just be sitting on top of a med cart that's getting pushed down the hall and being loose. The potential for that to get knocked over or spilled and then that coming all over the floor with needles, then you're really looking at a sharps injury potential. So really making sure when we have these sharps containers, we have them in a place where they're secured, whether it's the boxes on the walls, or I've seen some really ingenuitive, even zip tying something to a cart that's being used, those type of things to make sure that our sharps containers are secure. So just keep that in mind and look at your processes. A lot of times we'll find unsecure sharps containers in areas like tub rooms in the long-term care setting. They'll be sitting on a counter. Nobody's thought about needing a wall box for them. They just continually replace them right from there and they're never secured. So just think about that as you're going through your facilities and in your areas and watching to make sure that you guys have those secured and that somebody just didn't grab one and throw it on a counter. And now that's the practice that everybody's using to really contain our sharps. Next slide.
Exposure control plan.
Okay, so I mentioned we were going to talk about the exposure control plan. It is Bloodborne Pathogens standard, actually 29 CFR, part 1910, 1030. It basically what that is, it requires employers to write and implement an exposure control plan for employees with occupational exposure using administrative controls. So making sure that you have something within your facility that all of your staff are aware of that you have. It must contain things like cleaning or disinfection of how contaminated equipment, how we're doing that, how we're cleaning surfaces, those type of things. It also has to have things like the job classifications where employees have occupational exposures or risks, so things like that. The task and procedures in which occupational exposures occur. So maybe it's they're doing finger sticks, they're checking blood glucose, they're giving immunizations. So making sure we include those type of things. And then most local public health agencies will have an entire job classification in which all persons have occupational exposure, but they may have certain personnel that are assigned to duties that involve higher exposure. So also things like how we're handling laundry. That can be a big risk if we strip a bed and there happens to be a needle in there. What if I get stuck? What is our staff going to do there? Those type of things. Think we will go on to our next slide.
Exposure
If-
control plan.
If you have questions on your exposure control plan, here is a QR code that you can scan. Like I said, this will be on our website. So if you don't catch it during the call, you can certainly go back and grab it there. But it really outlines what you need for your exposure control plan, and then talks about things like where will staff find it? What is it? So staff has a full understanding of those type of things. This will give you some great guidance on that. So use that QR code if you are looking for some guidance and assistance on that. Of course, you can always reach out to us if you need assistance with that, or the DOH absolutely would assist if you're looking for resources also. Next slide.
Sharps injury.
All right. So Sharps injury prevention programs. These programs are really put in place for ways to minimize the risk, really addressing a wide array or all aspects. Key things the workbook can help you with, and the links here, and we can provide that for you guys. It tells about ways to access a facility sharp injury prevention program, document the development and implementation of your planning and prevention activities. It has sections to evaluate the impact of your prevention intervention. So if you're looking like, do we really have a good plan and is it going to make an impact? This has guidance there for that also. This is a workbook from the CDC for just that. So for designing, implementing, and then really evaluating your program. So if you haven't gone back and evaluated what you have, this is a resource that you could utilize. If we've had the same thing in our facility for the past 20 years and nobody's looked at it, maybe it's time to go evaluate our Sharps prevention program. Next slide.
Code again.
So we also have the QR code here. We've provided you a lot of codes today, so you might have been scanning like crazy throughout the program, but it is here for you to get to that easily too, now or after we wrap up the presentation and post it. Next slide. So what we're going to do is we're going to do a little bit of test your knowledge. Some of these things I just didn't tell you in the last, 30 seconds. So let's go to the next slide and start with the first one. And just a reminder, you can put your answers in chat or come off mute. So Bloodborne pathogens are A, a dangerous germ that lives everywhere, B, a microorganism that is present in human blood and can cause disease in humans, C, harmless germs, or D, bacteria that live everywhere in the body that can cause severe sickness. What's your answer?
Don't be shy. Put him in there. Get him. Oh, well, there we go. Looks like we
There
have
they come.
B.
Looks like we have a brilliant bunch with us today, which is fantastic. All right, answer is B, microorganisms that are present in human blood and can cause disease in human. Next slide.
Next.
Next question. How can HIV, HBV, and HCV be spread? A, casual contact such as shaking hands or hugging. B, through saliva, not contaminated with blood. C, by getting infected blood on your normal intact skin. Or D, by getting infected blood into the mucous membranes.
Like D.
Woohoo, we're geniuses.
D.
D is the correct answer. Next slide.
All right. Next slide.
What is the primary way HIV and HBV are spread? So A, sexual contact, B, providing first aid care, C, cleaning up a blood spill, or D, needle sticks.
Like we have an A, a D.
So on this one, and we have the resource here. When we looked at this as a team, we kind of had some mixed answers too. A is what is given as guidance as the correct answer. So sexual contact. Had a little stumper in there.
Mhm.
And standard precaution. Oh, sorry. Next slide.
Next.
All right. Standard precautions mean to A, be concerned with blood only as it is potentially infectious. Wear gloves for people who look sick. C, treat all body fluids as potentially infectious. Or D, wear goggles and a gown to treat all people.
Looks like C is the answer we're getting.
Fantastic. C is correct. Treat all body fluids as potentially infectious. We do find when we ask staff what standard precautions are, there is some hesitation there or why we're doing this. And I know we think as infection prevention leads that we are educating our staff. We tend to find that maybe even you presented on this or shared in a meeting, even up to a couple months ago, staff forget this. We give so much information in our trainings and our meetings that there's too much to absorb. So just maybe one tidbit to take away is just to provide little pieces of education throughout the weeks, each month, provide a different tidbit, those type of things to really hone in and keep reminding staff on things like what standard precautions mean.
Yeah, and maybe
Next slide,
change
and
the
then we'll wrap up all of these fun questions.
say maybe change up the education too. If you feel like you just covered it, but maybe no one got it, maybe change the way you cover it next time. All right, each workplace.
Each workplace must have a blank in writing which describes infection control practices. What do you guys think?
We have a B.
Perfect. Infection control plan. Of course, we have to have that. I know we're running out of time, so let's skip to the next slide here.
And we are in any questions?
All right. So before we open it up to questions, we like to leave some time in there if you guys have any questions that you can certainly ask. But we do have somebody on the call that you guys are, most of you that have joined our office hours and had us come and do iCards are very familiar with, Miss Sherry Fast. The reason I am mentioning Sherry and want to bring her up is she's no longer employed with South Dakota Foundation for Medical Care, where Rebecca and I work. She has transitioned to a big role at the Department of Health. So I just wanted to make you guys aware of that. And Sherry, do you have anything you want to share or remarks you want to give?
Well, no, you put me on the spot. I didn't know you were going to do that, but for anybody, just know that we are here to help you. The HAI department, we are non-regulatory and really we are just here to help. So if you need anything with infection control, you need an ICAR, you need training for your staff, you would just have a question, please reach out and let us know.
Fantastic. And we will get Sherry's email in the chat. So you guys have her updated email. I mean, if you email SDFMC, I will get the email. It'll bounce to me, and I certainly can assist you too, and either get you in contact with Sherry or provide you resources or information if needed. So
I think it's important, can I interject
Yeah.
just a second, Jess? I think it's important in the middle, we know that long-term care right now doesn't have a QIO in South Dakota, and so please reach out if you have questions. We don't want you just sitting out there with no help, so, yeah, we're available.
absolutely. And if that's NHSN assistance, we still have Lori Hintz on our team to provide NHSN assistance. So don't hesitate to reach out to us. She can still provide that. She's a great resource and subject matter expert on that for reporting for you guys. So just putting that out there for you. All right, next slide. We probably better get this wrapped up. We're running long because Jess talked too long today.
All right, so
Okay.
here is the,
Oh,
sorry, are you?
you're good.
continuing?
Go
I
ahead.
wasn't sure if you were pausing because you wanted me to take back over. Here's the
Go
QR
ahead.
code. I know that one of the things I was asked about, and I wanted to acknowledge that, you know, we did hear the request for the C. diff terminal cleaning question. It takes us a long time to get through processes, but that is on our list of something we will work on for you. But this is another opportunity here. After today's discussion, maybe you have a question or a comment that you would like to add for us. So please, please, please scan the QR code here. Let us know how we did and what we can do for you. Like Sherry said, us at the foundation or Sherry at the state level, everyone is here to help you. So with that, give a quick scan to that code and fill out the post evaluation. And we thank you for being with us today. I'll move on. As you can see here, we put some infographics from Project Firstline CDC level that relate to blood in both English and Spanish. So just know that those resources are out there. I know that some other states have them in other languages too. So by all means, go to the CDC website and look to see what other languages you can get them in if you are in need. And this QR code here, if you scan it, will take you to South Dakota's Project Firstline website, where you can find additional resources. Later, this recording and other recordings, sign up for our newsletter, just check status, communicate, reach out to us on there. We try to kind of keep that up to date with new things too. So with that, I will say thank you to everyone and thank you for joining us today. And thank you, Jess, for presenting.
Absolutely. Thanks, guys. Sorry for the problems.
Thank you.